Good morning and welcome to Webinar Wednesdays with SMP. We're really happy to have you all here with us this morning. My name is Sunny Lawless. I'm the volunteer coordinator for our SMP programs. I'll be your host, and presenting for us today will be Nathan Coughlin, who is one of our Georgia Community Outreach Specialists, and Keith Havens, who is our Media Outreach Specialist. Today, for our May installment of Webinar Wednesdays, we're going to be talking about virtual healthcare scams. So during the presentation, you're welcome to type any questions that you might have into the chat, but we're going to hold all of those until the end of the presentation when we open it up for question and answer. There will also be a prize drawing at the end of the presentation today. You need to have been registered for the webinar prior to 10:15 a.m. for your name to be on the list, and you have to be present to win. Before we get started with today's webinar, I do need to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services, as part of a financial assistance award with 100% funding by ACL-HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the U.S. government. So who is Senior Medicare Patrol? Well, SMPs are grant-funded projects, like I said, from the federal U.S. Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has its own SMP program. In Georgia, Louisiana, and Mississippi, SMP is sponsored by AdviseWell, and our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. Before I turn things over to Nathan, we do have a quick polling question for you. The question today is, have you ever used telemedicine or telehealth services? We're going to go ahead and launch the poll. Have you ever used telemedicine or telehealth services? So let us know yes, no, or if you're not quite sure what that is, you can say, I'm not sure. And I'll give everyone a few minutes or a few seconds to join in. Okay, a few more seconds. We're almost at 100%. All right, go ahead and share those results with you all. So it looks like 64% of you said yes, you have used those types of services, 27 no, and 9% you're not sure. So I'm going to go ahead and turn things over to Nathan now, and he is going to let you know what telemedicine and telehealth services are. Nathan?
Good morning, everyone. Interesting poll results. I'm sure a lot of y'all probably didn't use telemedicine if you're like me prior to the COVID-19 pandemic, and now most of us probably have, or a lot more of us have. So telehealth or telemedicine is a way to receive healthcare using your cell phone, home phone, computer, or other online digital communications. Next slide. Telehealth is designed to help patients in rural communities that may not have access to certain types of healthcare specialists. It is designed to help with healthcare gaps and provider shortages by providing access to specialists through telecommunications while reducing health costs. I think not just rural areas, here in the Atlanta area, a lot of my seniors I work with tell me transportation issues. You know, maybe they still drive, but they're not feeling well. They don't want to deal with Atlanta traffic. Telehealth has been a great option for them as well, in addition to our seniors in our more rural communities. Next slide. There are three main types of telehealth services. One, real-time video conversations, such as office visits and consultations with a specialist. This is known as synchronous telehealth. Two, the sharing of patient information between providers, such as X-ray reports and laboratory results, also known as asynchronous telehealth. 3, remote patient monitoring, also known as telemonitoring, uses technology to electronically monitor and transmit patient information such as vital signs or blood sugar testing. Next slide. Medicare covers most telehealth services in some form. In many states, Medicaid will follow the Medicare guidelines. As Medicaid coverage is different from state to state, it is always best to check with your provider to determine what telehealth services are covered in your state. Next slide. Medicare telehealth coverage must meet the following 4 primary conditions. 1, the beneficiary must be located in a qualifying rural area. 2, the beneficiary and distant site practitioner must communicate using an interactive audio and video telecommunication system that permits real-time communication. Examples are a telephone or a computer. Since often the iPads these days as well. 3, the beneficiary is located at one of 8 types of qualifying originating sites. An originating site is the location where the beneficiary receives the services through a telecommunication system. The site generally must be outside a metropolitan area and must qualify as a rural health professional shortage area, HPSA. The sites may include a physician's office, hospitals, rural health clinics, community mental health centers, skilled nursing facilities, and other specified places of care. A remote site practitioner may be a physician, physician's assistant, nurse practitioner, clinical psychologist, and other health-related professionals. For Medicare to pay for telehealth services, it must be coded Medicare Telehealth Services. Now that you have a better understanding of what telehealth is, we're going to talk a little bit about the fraud that occurs in telehealth. Telehealth is not immune to fraud schemes. Just a few of the schemes that have been seen with telehealth are billing for services not received, coding for services at a higher rate, as well as kickbacks and bribes for referrals. There has been a large expansion of telehealth services due to COVID-19 and patients having to shelter in place. Due to this, the Department of Justice has seen an increase in telehealth fraud. Even legitimate telehealth companies may encounter cybersecurity incidents that can expose large volumes of sensitive patient data. Next slide. Remote patient monitoring for conditions such as those with irregular heart rhythms, patients with hard to manage blood sugar, or after surgery. The patient may wear a monitor and need to log into the internet or connect with their cell phones to their physician's office as directed. The physician certifies that they have monitored the patient. In cases of fraud, the patient may have been monitored by an unlicensed person, such as a medical assistant, or is not monitored at all. Yet Medicare is billed as if the physician has been monitored by the patient, as if the physician monitored the patient themselves. There are cases where a telehealth service physician or someone falsely claiming to represent a provider provide a brief phone assessment and video consultation. In many instances, the patient is prescribed durable medical equipment, hospice or home health services that they don't actually need. The telehealth company works with a telemarketing firm to identify seniors in each area. These are often vulnerable seniors. Next slide. Another area of telehealth fraud is related to cybersecurity. This is when someone falsely acquires your personal information, such as your Medicare number, Social Security number, credit card, or bank information, using technology such as the internet. If you want to avoid becoming a victim of telehealth fraud or think you've been a victim, you should follow Senior Medicare Patrol's message. And now to talk about things that we will turn things back over. Oh, skip that part, I'm sorry. Next slide. So we're going to talk a little more about remote patient monitoring scams. This is something we've been hearing a lot about, so we definitely wanted to give you a little more information. Remote patient monitoring scams are another type of fraud that has been on the rise. These scams involve signing up Medicare beneficiaries for remote patient monitoring. While it is true that these are legitimate uses for RPM, or remote patient monitoring, that involve using medical devices to remotely monitor patients with chronic medical conditions that may cause them to quickly deteriorate, disreputable companies are enrolling Medicare beneficiaries for this service when it is not medically necessary. How the scam works. Medicare beneficiaries may be contacted over the phone or through online advertisements to sign up for RPM services. Equipment for these services in many cases may not even be sent or is not FDA approved. Billing then occurs for setup, patient teaching, and monthly monitoring of data. In most cases, the monthly monitoring never happens, yet the Medicare is billed regardless. How we can fight back against those things? According to the Office of the Inspector General, OIG's office, the following are some ways you can protect yourself or a loved one from falling victim to RPM scams. As the SMP message often talks about, review your EOB, your explanation of benefits, or Medicare summary notice, for any services or equipment that you did not order that Medicare is being billed for. If unordered medical equipment is delivered, don't accept it unless your personal healthcare provider ordered it with your consent. Be suspicious of anyone who offers you free medical equipment and then requests your Medicare number. If your personal information is compromised, it may be used in other fraud schemes. Remember, a trusted healthcare provider you know should approve any request for equipment or services to address your medical needs. Now that you've learned about virtual healthcare scams, Keith is going to discuss the 3 keys to success in stopping healthcare fraud, waste, and abuse: prevent, detect, and report. Keith?
Oh, thank you, Nathan. And as we'll see on the next slide, the first key is prevent. It's important that you protect your personal information. This is the best defense against healthcare fraud and abuse. So some tips that we have is that you don't ever only share your Medicare number only when it's necessary, such as when you go to your doctor's office or when you go to your pharmacy. And never carry your Medicare card with you unless you know that you're going to need to show it to a doctor or a pharmacy. And people always ask, well, what about the cases, if I happen to get into an emergency situation, I need to go to the hospital and I don't have my Medicare card on me. Rest assured that you will always be admitted into an emergency situation you don't need to show your Medicare card, but later you will have the opportunity, or someone in your family will have the opportunity to then give them the Medicare card number. So you don't need to have that on your person at all times. And also remember that Medicare, and this goes for any government agency, the IRS, Social Security, they're not going to call you and ask for your Medicare number. They're not going to call and ask for your Social Security number. They don't need for you to verify that. They know what your number is. And first of all, you're not going to get a call from them. Most of the time, they communicate through a letter. So if you get a call and that person is saying they're for Medicare and they're asking you to verify your number, that's the time to hang up, okay? And then also, we want you to keep records of all your medical visits and procedures that take place and medical equipment that you order. And this will be important for the next key that we want to talk about on the next slide, which is detect. So the reason why we want you to keep records of all your visits and your medication and anytime you go into the hospital or whatever, we want you to review your Medicare summary notice or your explanation of benefits for any kind of inaccurate information. Maybe some kind of there's medical appointments that you did not attend, or you maybe something that you were double billed for, or especially if you see any kind of medical equipment that we call durable medical equipment, DME, such as braces, or any type of catheter or diabetic supply, and you did not order them, or maybe you did, that's something you do use, but you didn't receive it, then that's why you keep records of all this, so you will be able to detect Medicare fraud on your MSN or your EOB. And then on the next slide, the final and third key is to report. So if you suspect fraud, if you review your MSN and you see something that doesn't look right, or you get a call and somebody's asking you to give them your Medicare number, or they're asking you, do you have back pain or do you have knee pain, and we can give you free braces for that, please call us. Now, what we suggest that you do, if you see something on your Medicare summary notice or your EOB that doesn't look right, we ask that you first call the provider that you have a question about. And if you call them and you're still not satisfied, then please call us at our SMP hotline. And you can see the number right there. And if you don't have this number written down, I would suggest that you get something to write down right now and keep this somewhere. Maybe put it in your phone and your contact information. But this is our hotline number, 877-272-8720. So if you have any questions or doubts or whatever, please give us a call. Now, on the next slide, you may be wondering, well, how can I get more involved in help fight Medicare fraud? Well, we always need volunteers, and we welcome anybody who wants to get more involved. And the benefits of volunteering for our program include gaining the satisfaction of participating in a national effort to empower members of your own community to prevent, detect, and report healthcare fraud, errors, and abuse. Our volunteers receive training on the basics of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in bi-monthly webinars and various training opportunities throughout the year. We also host a volunteer appreciation event in April for National Volunteer Week. Now, understand that volunteering for the SMP program is extremely flexible and is done on an as-needed basis. Volunteers are offered opportunities and have the option to decline if they are not available. They determine how often they would like to participate. We also want to mention that this is a great volunteering opportunity for couples. In the past, we have had couples team up to volunteer, give presentations, and attend community events. Now, if you think volunteering for SMP is something you might be interested in, give us a call, again, at that toll-free number I just told you about, 877-272-8720. We would be more than happy to send you one of our volunteer information packets and answer any questions you might have about the process. And then on the next slide, We really encourage you to follow us on social media. Follow us on our Facebook page. We have a Facebook page for each state, and we have a YouTube page that we put all of our videos on there. And we also have podcast, Sip and Learn with SMP, and that you can find on Spotify or on Apple Podcast. So if you will see this QR code on the screen, if you will take your phone in the camera mode and hold it up against that screen, and you will see a little yellow thing. You can click on that, and it will open up a page that gives you all the links to all of our social media and everything that you can keep in touch with us. And we really encourage you, if you are on Facebook, to follow us, to click on to follow your state-specific Facebook page. Okay, so again, we ask that if you need to contact us for any reason, to report fraud, to ask about volunteering or whatever, that's our number. We also have our web page, stopmedicarefraud.org. You can get more information about that as well. Now, speaking of volunteering, our next month's topic on Webinar Wednesday is volunteering for SMP. So that would be a great opportunity if you want to learn more about volunteering. Look for that invitation and sign up, register for next month's volunteering for SMP.
Yes,
and now
thank you, Keith.
Hand it back to Sunny.
Thank you, Keith and Nathan. Yes, so next month is going to be all about volunteering for the Senior Medicare Patrol program. That webinar is scheduled for June 28th at 10:30, so just kind of be on the lookout and you'll receive an invitation to join us then. All right, so next up, we're going to do our prize drawing real quick. You had to have been registered prior to 10:15 this morning in order to be on our prize wheel. And the winner is going to receive their choice of a $25 Amazon or Walmart gift card. So let's see, let's get that prize wheel up. Let's see, I'm going to remove some of the names of the folks who aren't here. That'll kind of help us here. Let's see. And I think that's everybody that's here. Okay. Elsie, yeah, Miss Judy Mark. Okay, yep. All right, so I'm going to go ahead and give this wheel a spin and we'll see who our prize winner is for today. All right, congratulations, Miss Elsie. It looks like you're going to be our prize winner for today. So I'll be reaching out to you a little bit later this afternoon to find out which e-gift card you want, whether you want the Walmart or the Amazon e-gift card. All right, so before we wrap up today's presentation, we'll go ahead and open the floor for Q&A. And it looks like we did have a question earlier in the presentation. Let's see, that came from Mark. Let me open that up real quick. So Mark says, my understanding is that you should not laminate your Medicare card, and that when he's out telling, working for SMP and such, he tells people, including physicians, when he tells them that they shouldn't laminate their Medicare card, they're surprised. So is that something that Medicare does say we shouldn't do? Maybe Monique, you can help us answer that question.
Yes, can you hear me?
We can.
Okay, Perfect. Mark is correct. Social Security Administration, SSA, who actually issues the Medicare cards, suggests that we do not laminate it because lamination prevents detection of some security features.
Okay, well, that's good to know. I kind of always thought it had something to do with when you copy them, when they would make a photocopy that maybe, you know, at the physician's office, that it wouldn't show up the right way.
Mhm.
So
Absolutely true. But something to be aware of, I'm sure some of y'all that do our webinars a lot are already aware of, a lot of scammers know the Medicare card's made out of paper and it gets frayed and torn very easily. So they're calling people saying, hey, we're Medicare. We're going to send you a new plastic Medicare card that won't fray and tear up that way. But please know, Medicare is not sending anybody plastic Medicare cards. That is just a ploy for them to get you to give your Medicare number to them so they can steal your Medicare number and use it for things that aren't legitimate.
yes, that's right. We did just recently do a postcard about no new Medicare cards. And a lot of the questions are, you know, people that called once they received that postcard, you know, they had gotten those phone calls about those new plastic Medicare cards. And that was one of their biggest complaints is their card was wrinkled or frayed, messed up. And so they were really interested in getting, you know, some sort of laminated or plastic card. And, you know, could easily fall for those types of calls whenever they come in. So thank you, Mark. That was a great question. Does anybody else have any questions? You can raise your hand if you like, and we can unmute your line and you can ask. Okay, well, I'm not seeing any other questions come through. So that's going to conclude our presentation today on virtual healthcare scams or telehealth fraud. You'll be receiving an email later today with a link to a short survey. We would appreciate it if you would just take a moment to answer that survey and let the Administration for Community Living know how today's presentation went. We appreciate you all joining, and we hope to see you again for a future webinar. Thank you and take care, everyone.